Hi there, so we've created this resource for current students, new grads, as well as the family and carers of people with a TBI. So we've involved evidence-based practice, we've created a resource fact sheet, and this is just a video to accompany that. So I'm going to ask you a couple of questions regarding the resource. So what is the reason for developing this resource?
So according to the World Health Organization, traumatic brain injury is the most significant cause of death and profound disability from major trauma. And despite this, there is a lack of clear resources supported by evidence addressing how families can best support a person with TBI.
Okay, so what information does this resource draw upon?
So this present resource draws on information provided in the clinical guidelines for TBI. So we've adapted the recommendations made directly to benefit the communication between people with TBI and their families. So while student clinicians can search for this information, it is not always presented in a clear manner with examples directly made on how to directly apply the information. So when a person has a TBI, the family and friends are often bombarded with so much information, and searching for what they can do to help can be overwhelming with many suggestions, and not all of these are based on research evidence.
Okay, so how will you make this resource in an accessible manner?
So by providing this video and accompanying handouts, student clinicians and families are delivered high quality evidence in a more accessible manner. This video is short and can be referred to throughout the duration of TBI recovery, and the handout provides a physical resource families can keep handy.
So as a speech pathologist developing a communication rehabilitation program for a person with a TBI, what are some of the most important things to remember?
So it is really important for speech pathologists to create the program in a holistic approach that is individualised and patient-centred. So communication partners who will communicate the most with the person with TBI need to be educated and trained, so this is including close friends and family. And it is important that the person with TBI has a support person who understands the best ways to communicate and can therefore explain to other people what these best ways are.
Okay, so how do you as a speech pathologist tailor the therapy for real-life communication?
So individuals with TBI need to be given the opportunity to practice their communication skills in situations appropriate to the context in which they will live, work, study and socialise. This can be done as role plays in a safe setting, and eventually this can guide the person with TBI to communicate with others in society. But it is really important that these communication skills and strategies are rehearsed with the speech pathologist and that they feel comfortable, so it can therefore be generalised into other contexts when they are by themselves and not with us.
Okay, so what about if the person with a TBI requires additional support communicating?
Yep, so obviously some patients may need AAC, so augmentative and alternative communication aids, and they will need to be trained in using these. And it is helpful to have this support person I was speaking about earlier to be there for these training sessions so they can assist the person with TBI if it's needed. And also it's important for speech pathologists to consult occupational therapists when considering how the individual will use the AAC to consider their motor capabilities.
So as a family member, friend or a carer, what tips could you give me to help me successfully communicate with someone with a TBI?
The most important thing to do is be flexible with your communication. It might be helpful to use visual tools or aids like photos, a diary or a calendar for future and past appointments, or writing down key words or phrases during a conversation.
So what if there's a breakdown in communication?
If you experience a breakdown in communication, be honest about it and acknowledge it. Don't be embarrassed by it. Tell the person with TBI you're not sure what they're saying, but you want to find out and you're going to try and help them to get their message across. You can do this by changing the style of the question you use from broad, open-ended questions to forced choice, where you provide two options or a yes or no question.
Okay, is there anything else we can remember?
It's also really important to remember that the environment can impact how easy or hard a person with TBI finds it to communicate. So try and set up a supportive communication environment by reducing the amount of background noise or distractions. Also consider whether the person is affected by medication, fatigue or pain, And finally, remember that just because a person's communication is affected doesn't mean their cognition is as well. So please avoid speaking to them in a patronising way.
So thank you for watching our short video providing a clear and accessible way to access evidence-based practice information. Please have a look at the handout that we've provided and hopefully you enjoy. Thanks.